In the 2 weeks since the Supreme Court overturned Roe v. Wade, abortion access has dramatically changed in several states across the country.
That includes Mississippi. The state's last abortion clinic shut down on Thursday. It was also the clinic at the center of the Supreme Court's decision. Earlier today, President Biden signed an executive order that aims to protect reproductive health. He also spoke about the new normal for abortion access in America.
The most extreme Republican governors and state legislatures have taken the court's decision as a green light to impose some of the harshest and most restrictive laws seen in this country in a long time. So their choice is clear. If you want to change the circumstances for women and even little girls in this country, please go out and vote.
Isabelle Taft joins us now. She is a community health reporter for Mississippi Today. Isabelle, thanks for joining us. I have to ask, Isabelle, with this clinic closing its doors for good, what options do women in your state have when it comes to reproductive health? It wasn't just a place for abortion.
Yeah, thank you so much for having me, and thank you for that question. Currently, the clinic is referring folks to a clinic in Columbus, Georgia, which is owned by the same owner. Otherwise, the state of reproductive health care in Mississippi, I think, is really dark because we have so many healthcare needs in general. We have one of the country's highest rates of uninsurance. We have rural areas that are basically healthcare deserts, and that's especially true for maternal and pregnancy-related healthcare. And so we have had really high rates of unplanned pregnancy. We have the country's highest rate of teen pregnancy, really high rates of STDs, and that's in large part a function of the fact that people struggle to access healthcare at all because it's very unaffordable for people who can't get insurance because we've not expanded Medicaid, and there are parts of the state where there's essentially no providers.
Yeah, in fact, was Mississippi one of those states that rejected the ADA with Obamacare?
Yeah,
they did.
Yeah, and in fact, our legislature this year refused to extend postpartum Medicaid coverage. So many other Deep South states that have not expanded Medicaid have still made the decision to give pregnant women a full year of Medicaid coverage after their child is born. Mississippi refused to do that, and so women lose coverage 60 days after giving birth.
So that kind of leads into my next question for you, Isabelle, because given that Mississippi is imposing this near total ban on abortion, is there now added pressure on state officials to create a support system for these new mothers, or not necessarily new, because we know that most women who seek abortions already have children. So these women who are struggling with their new children or the children they already have, are there now new support systems that are going to come up to help these women who would have otherwise sought an abortion?
That's a great question. There's been a lot of talk along those lines, but I think so far there has not been a lot of concrete action or proposals to do anything that would concretely make it easier to access healthcare in Mississippi in particular. What has been talked about a lot so far by Republican leadership, the governor, the attorney general, speaker of the House, is that they want to expand access to adoption, make it easier to adopt. They want to improve the child protection system. But those are all areas in which Mississippi has really struggled. In particular, the child protection system is a subject of a long-running federal lawsuit. Most recently, the monitoring report in that lawsuit found that in 1 year, 117 children in CPS custody were abused or neglected by their caregivers. So there's a lot of work to do in those areas, and state leaders have not provided a lot of specifics in terms of anything that might actually provide concrete benefits to moms, to families. And they have touted a $3.5 million tax credit to crisis pregnancy centers. There's about 40 of those in our state, but those are not equally distributed around the state, and they don't offer many medical services other than ultrasounds and pregnancy tests.
In under 20 seconds, could you just give us your response to what President Biden did today in hopes to expand upon some access to health care?
I haven't seen the speech, but I think it's going to be probably, I don't know how much impact it'll have in Mississippi, and we have so many just basic needs in terms of healthcare access that I think people are going to really struggle with even things like obtaining contraceptives and preventing unplanned pregnancy, kind of no matter what happens at the federal level.
Wow. Isabelle Taft, thank you so much for reporting on the state of reproductive health there in your state, Mississippi. We appreciate it.
Thank you for having me.